Now, today your lecture of obstetric and gynae. I am Dr. Pradima, Assistant Professor, Department of Obstetric and Gynae. Today our lecture is Polyhydramnios and Polyhydramnios. Now, first of all, we came to know that what is the physiology of amniotic fluid. In early pregnancy, the composition of amniotic fluid is like extracellular fluid. As you people know, extracellular fluid is the fluid in the body. Now, the composition of the amniotic fluid is similar to extracellular fluid transfer of waste across amnion and through fetal skin. What happens in the early pregnancy? The water transferred through the amnion, which is the outer layer of a baby, and through fetal skin. But in the second trimester, what happens? In the second trimester, fetus begins to urinate and swallow. In first trimester, the fetal skin help in the transfer of the water. But in the second trimester, the urine and swelling is start. So this urine and re-swelling of this water help in the formation of amniotic fluid. During last 2/3 of the pregnancy, amniotic fluid is principally comprised of fetal urine. Now, what is the normal amount of amniotic fluid in the different gestations? Like in 17 weeks, the amniotic fluid volume is 200 ml. While in 28 weeks, it reaches to the 1000 ml. In 36 weeks, it again 100 milliliter less and goes to the 900 ml, and at 40 weeks it goes to 800 ml. Now you see, as the pregnancy advances, the amniotic fluid volume is increased, but when the pregnancy ends up to the term, it again reduced in amount. And when the fetus crosses the 40 weeks, means up to 42 weeks, it is again reduced. So it is advisable that we plan for termination of pregnancy at 40 weeks. Now, what is amniotic fluid? As you see in this picture, this is the amniotic fluid, the water in which baby moves. This is the water. This is the water. It is the clear yellowish fluid that surrounds and protects the fetus in uterus. How it protects? It protects from because uterus is a muscular organ. It can exert pressure on the fetus, but that amniotic fluid, what it did, like when you blow a balloon and fill it with water and put a baby inside that. So that what that water do? The baby moves in that water, the baby breathes in that water, the baby swallows that water, and the baby urinate in that water. So this helps in the movement of the body, in the movement of limbs and arms. Otherwise, what happens if we remove water from that balloon? You just think that if we remove water that balloon and balloon stick to the skin of the fetus, it leads to the fetal contracture and limb deformities. Now we come to the main subject, that what is polyhydramnios. Poly means excessive and hydro means water and amnios means amniotic. The amniotic fluid more than 2000 cc. The amniotic fluid index. What is the amniotic fluid index? When we go in that picture, there are this is an ultrasound finding. This we measure the deepest vertical pool in 4 quadrants. This is one quadrant, this is second, and if it is a complete picture and it is a half picture, then in other 2 quadrants. We calculate the deepest vertical pool, and this deepest vertical pool should be devoid of cord. Devoid of cord means there is no cord in that pool. So when we measure that pool, and in 4 different pools, The four different quadrants. The largest vertical pool is more than 24 centimeter, then it is known as polyhydramnios. This, as in this picture, if we one quadrant, two quadrant, three quadrant, and this is two. As we don't take it because there is a cord in this quadrant. So we take this quadrant. So when we take this and the total of this is more than 25, then it is known as 25 polyhydramnios. What are the causes of polyhydramnios? Polyhydramnios mean excessive production. Where this excessive production occur, it means be idiopathic, means without any cause, any fetal anomalies. What are that fetal anomalies? Any anomaly which leads to when there is no swelling in the fetus, because fetus swallow that amniotic fluid. Whenever there is a problem in swelling, like anencephaly, in which head is absent, there is esophageal ectasia, esophagus is not present, there is any skin deformities, it leads to the polyhydramnios. In diabetic mother, when the sugar is not controlled and that glucose pass through the placenta and goes to baby, and it leads to the increased production of urine, it leads to the polyhydramnios. Multi-fetal gestation means more than say a single fetus, triplet, twins, quadruplet. In these, there is also like a increase. Immune and non-immune hydrops, any fetal infection, and placental hemangiomas. What is the etiology of polyhydramnios? Fetal anomaly. What happens in polyhydramnios? As I told, that fetal anomaly which lead to the difficulty in swelling and GI absorption, and lead to the increased transportation of fluid like anencephaly, spina bifida, increased urination like in anencephaly. Anencephaly, there is no brain, there is lack of antidiuretic hormone which leads to the stimulation of urination center and decrease inspiration. Now, what is the symptoms of polyhydramnios? As you people saw the picture, there is a large amount of volume in a mother's belly, so that woman dyspneic, unable to breathe properly, due to the large amount of fluid in her belly, there is abdominal pain. Due to large amount of gravid uterus, there is pressure on the vena cava, which leads to the venous stasis. There is early contractions may be started, lead to the preterm labor. Decreased perception of fetal movement. What is the diagnosis? Fetal height more than the gestational age. We can't assess exactly the fetal parts, and we can't hear the fetal heart sounds. Tense and tender uterine wall, confirmed by ultrasound. What is the fetal prognosis? What affects the fetus in polyhydramnios? If there is a fetal anomaly, then the prognosis is definitely very worsened with more severe hydramnios and with anomalies. 50 to 20% have fetal malformation. There is, as I told, early contraction starts, so early preterm delivery suspected if patient is diabetic, then diabetic complications, and also leads to the fetal diabetic complications. There is large amount of volume. If preterm delivery, early rupture of the membrane, baby's head is not fixed, and it leads to the prolapse of cord. Abruption. Abruption is early separation of the placenta from its place, which leads to the abruption. What happens to the mother? As I told, dyspnea, venous stasis, placental abruption, uterine dysfunction. These patients, when delivered, there is difficulty in proper contraction of the uterus, which leads to the postpartum hemorrhage and abnormal presentation. As lighter is increased, baby movement is very frequent and the fetal head is not fixed in the lower pole, which leads to the abdominal presentation and increase the risk of cesarean section. What is the treatment? If patient have mild to moderate hydramnios, this rarely requires treatment. Only conservative treatment. Patient is hospitalized, bed rest, and NSAIDs, non-steroidal anti-inflammatory drugs. What NSAIDs do? It reduces the amniotic fluid volume, and if the patient is diabetic, then proper blood sugar control, optimize her blood sugar level. And if there is an increase, moderate increase, then we leads to the amniocentesis. Amniocentesis is like, what is amniocentesis? Drainage of the amniotic fluid by passing the spinal needle through ultrasound guidance in the abdomen and drain that excessive fluid. Now our second topic is oligohydramnios. I told that what is AFI? The deepest vertical pool in 4 quadrants. When we take the 4 quadrants and we take the vertical pool, divide of chords, and if it is more than 25 cm, then it is polyhydramnios, and if it is less than 5, then it is oligohydramnios. Now you see in this picture, there is a uterus and there is a baby. There is no fluid in this. Minimum here and minimal amount is here. Baby is hugged with that uterus. You can see in this picture, there is no gap between the uterus, uterine wall and the baby. What is the etiology? As I told that when the 40 weeks, the amniotic fluid volume is 800, and when it goes to the 42, it decreased to the 400. So if we see that the amniotic fluid volume is very much decreased, then maybe the patient is post-date, means it is more than 40 weeks. There are certain fetal anomalies which lead to the oligohydramnios, in which there is obstruction of the urinary tract or renal agenesis. Why renal abnormality? Because as I discussed earlier, I told you earlier that urine in the second trimester, this liquor, this amniotic fluid is formed by the kidneys. So whenever there is kidney abnormality or urinary tract abnormality, it leads to the oligohydramnios. IUGR, intrauterine growth restriction, means when the baby is small, it is not adequately according to her dates, then it leads to the oligohydramnios. Rupture of membrane. Rupture of membrane is, this is the membrane. This is the membrane. When it ruptures, there is a leakage of fluid from the maternal vagina and leads to the decreased amount of fluid in the baby. No-in-twin transfusion syndrome is a complication of a multiple pregnancy, exposure to the ACE inhibitor and non-steroidal anti-inflammatory drug. What are the signs and symptoms? Spondylitis less than gestational age, decreased fetal movement, fetal heart rate tracing abnormalities, diagnosis confirmed by the ultrasound. Always, whenever we confirm the confirmation of the polyhydramnios or oligohydramnios is through the ultrasound. Now you see what happens. This is uterus. This is water. This is amniotic fluid, which is very decreased. Uterus. This is the amnion, and baby is hugged in that cavity, and there is enlarged kidneys because urinary production is very less. There is some abnormality in the kidneys, so there is enlarged kidneys, hydronephrosis, bladder is enlarged due to the pressure. Baby may have clapped feet, contractures. Now, extremely poor fetal prognosis, especially in early pregnancy. Adhesion between amnion and fetal parts. which leads to the malformation and amputations. Musculoskeletal, why amputation? Because fetal part is very delicate, and if there is a continuous pressure in that part, then it leads to the amputation. Musculoskeletal deformities due to the pressure effect of the uterine wall, and pulmonary hyperplasia. Why pulmonary hyperplasia? Because that whenever this amniotic fluid is swallowed by the baby, it leads to the production of surfactant in the lungs, and this surfactant help in the lung expansion and start of respiration. When this liquor is not present, amniotic fluid, it leads to the pulmonary hyperplasia and cord compression, which leads to the fetal hypoxia and passage of meconium into low amniotic fluid volume. Thick particulate suspension, respiratory compromise. What is the treatment? Delivery and amnioinfusion. Either we plan for the delivery because there is no LICA, there are all complications, there is pressure on the fetus, cord compression, which leads to the hypoxia and death of the baby in vitro. And what is amnioinfusion? Like in amnio reduction, we insert a spinal needle, and in polyhydramnios, we insert the spinal needle and remove the excessive amount. In this, we insert the spinal needle and we infuse a saline or into the abdominal cavity, or sorry, not abdominal, in uterine cavity. Look at this picture. In ultrasound guidance, we insert a spinal needle in the uterus, and we insert it through the mother's abdomen, and amniotic fluid is drawn for analysis. As you see here, the same process, we do the amniocentesis or amnioinfusion. Now, thank you for the lecture. If there is any problem, you can ask the question. Is there any question? ये प्लीज स्टॉप कर दें. जी